Hello, everybody. Good morning, good afternoon, good evening, wherever you are. It's wonderful to be back and to be with you all. So, we will take 5 minutes for the beginning of the session. So, if you are watching this later, you can just forward the first 5 minutes. Otherwise, you can, be with us. It's great to have you here. Yes. Hello, Dr. Raghu. Yes,
Hi.
we are live. So let's check and let me check and see if everything is working everywhere. Yes, YouTube is cool. Let's check out on Facebook. So, yes, okay. Once I hear my own voice, I know everything is fine. We are fine. All good. Okay, right. So let's put a message for everyone who's there. So, who's there? Please let us know who has already joined. It would be nice. We have a few minutes to chit chat so we know you're there. And if you can also let us know which part of the world you are joining from, that would be marvelous too. And yes, so I'm all excited about today. Yes, Dr. Shilpa. Hi, Dr. Shilpa. Good morning. Nice to have you here. Raghu, you can also interact with the audience. You can say hi, you can speak, your mic is on.
Hello. I don't know who has joined actually. Hi,
You
Shilpa.
cannot see it? Yeah. Okay.
No, I just saw Shilpa now.
Yes, correct. Yes, there she is. She's waiting. And Dr.
Hi,
Arpan,
Arpan.
hi. Dr. Sham Naran, good morning. Yes, good morning to you too. Actually, I'm myself rather excited about today's topic, I must say. I mean, it's always, all the topics are exciting, but this is a discussion that's like been weighing on so many people's mind for a long time. Yes, Shilpa is also saying hi to you now. Okay. So, Raghu, you can see on the screen as I bring the comments, right?
So I just see Shilpa's message. Good morning, sir.
That is what I have
Uh,
brought on the screen,
yeah,
correct?
and
Okay.
on. I mean, when I minimize, I see the private chat.
No,
Uh,
so next to that, on top of that is also comments. You click on the comments, and then you will see everything that's happening
ah,
on
okay,
YouTube
okay,
and
okay,
Facebook. Yes. Okay.
okay.
Right. You got it. You got it. So, yes. And I have changed the video, huh?
Yeah, I know that.
Oh, and my
Yeah, you're
favorite
doing a
kitties are there on
fabulous
it.
job. I must admit, you are doing a fabulous job.
Thank you. I think we are on time. Yes. Okay. Let's just go with the program now. And I seem to have a momentary problem. One second, everybody. Okay. Right. Okay, yes. Sometimes all the screens and all the different shares. So, okay, we are at the official beginning of the program. So, welcome to Oral Pathology 360, the Thinking Outside of the Box series. You might remember recently we had a session where we discussed open access publications. Now, in that session, a lot of other issues were raised and discussed. Among those, very interesting was what other metric can we use if it is basically this dependence that academics have on being published in this era of being publish or perish. It is putting us at a lot of risk for a lot of predatory journals, and sometimes also tempts people to do what I would say slightly, maybe not completely overboard, slightly questionable acts. So in which case, what else do we do? How do we go beyond it? Was an issue that was raised then, and today we are going to take it further. And for that discussion, we have with us today a good friend and a great colleague who is not just an oral pathologist, but he has also been a great researcher and also been in a lot of university work. So he knows exactly what are the things that happen as far as appraisal goes, and which is why he's joined us. Dr. Raghu Radhakrishnan is a dedicated academician, passionate about quality education and teaching. In his 22-year career, so far, he has had many achievements in every field he has been involved with, breaking barriers and setting trends in cooperation while learning at every opportunity. A recipient of the Marie Curie Fellowship, currently Dr. Raghu Radhakrishnan is a professor of oral pathology in Manipal College of Dental Sciences and is serving as Director of International Collaborations, Manipal Academy of Higher Education for the seventh year. Right. So, welcome, Raghu. Officially welcome now.
Thank you very
Okay.
much.
You are most welcome and always welcome. We love having you here. So, yes, you are a part of the team, anyways. So, okay, now let's just get into it. Now, when we decided last time, what we were discussing was, of course, academic appraisal. So, I guess the best thing and the first thing to do is to start by thinking where we stand today. Where is the typical kind of an academic appraisal that happens today? Because as we know, of course, academic appraisal has, or any appraisal has two reasons to happen. One is administrative evaluation and the other one is developmental, to improve or to be a reason and to find how to grow and become better. Now, in that standard, where do we stand today? We know that for the most part right now, at least in India, the academic appraisal is a combination of two factors, is basically how many years of experience you have plus publications, how many publications you have. And as far as dentistry goes, recently DCI has also updated those and given some points to things. So uh, now let's see how, let's Dr. Raghu weigh in. Yes,
Uh, Thank you, Dr. Mandana. Am I audible?
yes, you are all good.
Uh, Mana, I think this is spillover of the discussion that we had with a number of other colleagues uh, who were part of your esteemed panel. And as an oral pathologist, I think I have a lot of young friends who have joined this morning for OPAT 360. So, as oral pathologists, the burning question on everyone's mind is oral pathology as a career itself. Some are skeptical, some are philosophical, some are indifferent, and some are very critical about it. I think through uh, today's discussion, I want to be as philosophical as possible, and where necessary, I'll try to be a little critical just to improve the profession and the professional standing. A popular notion amongst the oral pathology colleagues in India is that teaching is the only viable option. As Dr. Mandana had briefly introduced me, I enjoy teaching because that's what I began as when I joined. the Manipal College of Dental Sciences. Over a period of time, I was exposed to research, and then when you become a senior and after a few years, you have to take up some of the administrative responsibilities. So that's how I become the administrator. So to put it in a nutshell, uh, it's important to realize that for any professional, be it an oral pathologist or any academician, there are four uh, disparate yet interconnected strands: teaching, research, and more importantly, the laboratory services as oral pathologists, because we are all involved in the biopsy service. And for a clinician, it is the clinical service. And the last, of course, is the administration. So, while not all the strands are attractive to all, the choice actually rests on an individual. The question is how you apply the knowledge and skills that you have acquired as an oral pathologist. So, you may be passionate about teaching, you may be passionate about research, you may be passionate about the pathology practice. So, with the current appraisal system, are we able to pursue our passion? Or if there is a disparity between what you are good at and what is expected of you. So there is a big gap. The perception is that you're a great researcher, but the truth is that you're passionate about teaching and pathology practice. So this is where the performance appraisal framework has to be developed so that you get the best out of an individual. And to discuss more of that, I'm happy to take some questions from you and also happy to engage with a meaningful discussion with Dr. Mandana. Thank you, Mandana.
Yes. So, okay, now we are discussing where we stand right now. So, amongst the, and I have a feeling that this is what we have got is not just us, but it is also what is there for the MCI on a similar lines. That's the Medical Council, and it's possibly around the world in many places. It's the same. Although I have found different appraisal systems which go beyond just publications and the number of years and what you have done and what sort of publications you have. Now, in this, it's very interesting because, of course, there are the points that are given to publications. And as we can see here, we have this thing which says how many points the head of department needs, how many the professor needs, how many a assistant or a reader needs. And then, of course, these are combined with the number of years that you have to have been in service or working in a college. Uh, the main thing is, like Dr. Raghu said, is that it is not taking into account a number of other things. I'm not saying necessarily that this is wrong, but there is a lot of, obviously, a lot that can go wrong with a system that is only focused on two things. One is really out of these two things, the number of years is literally an accident of nature, I guess. You know, you have been there for a number of years because of when you finished and when you joined. It's age. It's just that. It's how long you've been around in a post. And well, that is not merit based. But on the other hand, I know that itself is a really what I would say, a highly discussed topic. But the other part is the kind of publications you have. Now, I can understand that research has always been important because it's in a way when you say that someone is doing research is because they are remaining updated. A researcher is updated. And that is what we want from our teachers, which is in a way why research came into any appraisal system. But on the other hand, it can't be the only thing. That I think teaching essentially has to be about teaching first, which means not just the ability to go and take a class, but so many other abilities: how to explain, how you can interact with the students, how good you are at that interaction, how clear you are at expressing your thoughts. All of these go into that. And then there is this very interesting thing. Of course, there is a certain quantum of administration that comes in as you progress, and it is always there. And I came across some very interesting thing that I should share with you, because I know today a lot of our colleagues are stuck with doing things like requirements of fulfilling the NAC paperwork, the accreditation paperwork. You will be surprised just how many people who I have called to invite to speak have told me, oh, the next 5 6 months I can't do anything because I have to finish the NAC work. So this is, I do not think is the, and for a lot of it, because the entries of the NAC details is literally clerical work. It's just entering details, collecting and entering. So is that the best use of a professional's time? As I was going and preparing for today, I came across a comment from Professor Feynman. Now, all of us know him. He is a great physicist, Nobel Prize winner, great contribution to a number of fields, quantum physics, etc. Now, he said that he knew if he was ever to do anything else, besides, of course, he was only research oriented and teaching oriented. Okay. He said if anytime in his university they told him to do anything else, he used to just say, no, no, you can't depend on me. I'm too irresponsible, so I cannot take the job. Now, in today's world, it is possible that if one of us had to do that in our post, we'd probably be without a job. So the whole question is, what happens in those cases? Would today's situation allow someone like a Professor Feynman to grow and to really develop what he is good at? Like what Raghu said, you have to know what you're good at and be given a chance to do that, not everything else. Or would in today's world, someone like Professor Feynman not survive and may not have even got the kind of a tenure that he needed to do the work he needed? Is this what is happening today? So, this is where we are thinking about the appraisal system. So, where the appraisal system is right now, and I know, and we have got colleagues from around the world. I would love to hear what the appraisal system is in other places. But in general, if it is going to be just years of experience and number of publications, there are loopholes there. Because the minute we go with number of publications, then it's become a weightage. It is like we get too much of something. When a measure of something becomes the target, then we have a problem, like what Dr. Raghu was talking about the last time. So now we have an idea of where we stand right now. So this is our beef. This is our problem with the current measure of the current appraisal system is it does not take everything into account. The things it takes into account have now stopped being a measure and have become a target. So what else can we do? Where can we go? What are the other ways that appraisal can be done? Now, I know that the Manipal Academy of Higher Education is one of the best universities in the country. It also is well beyond even just medicine or dentistry. They have multiple disciplines across a number of institutions and in two countries. So there's a lot of mixture of experience there. So I'll let Raghu now tell us what they use there. Yes, Raghu.
Sure. Thank you, Dr. Mandana. Uh, so before we dwell into the performance appraisal framework, the reason that we are even discussing this is because somewhere unknowingly or knowingly, we have adopted this publish or perish culture. So basically, this publish or perish was a term that was coined way back in the year 1932 by Coolidge, and now it has actually become a harsh reality. So, what exactly this aphorism refer to? It basically describes the pressure to publish academic work in order to succeed in an academic career. And if you go by the simple framework that our council has laid down, everything revolves around the publication paradigm. That somebody has to have 40 points to become the professor and head of the department. Somebody has to have 30 points to become a professor, and somebody has to have about 20 points to become an associate professor. But let us for a minute look at it philosophically and see if there are any advantages of this publication or the publish or the perish culture. See, in some universities, I think in most of the universities which are research oriented or research intensive, they often argue that some pressure to produce cutting edge research is necessary in order to motivate the scholars very early in their academic careers. It's primarily some direction given by the university authorities for the younger colleagues to stay research focused. And it's also argued that the youngsters or those who are in their early career research are expected to balance between their research productivity and other professorial activities that they are involved with. And with this, there is an incentive attached, and that is if you have an increased research output, if there is a robust body of published work, it helps you advance your professional career. So, this is the premise to promote the publish or perish culture. But what are the disadvantages of this terse, laconic expression? So, there is obviously pressure to publish. And because of that pressure, it often results in poor work being submitted to academic journals. People are publishing things which should never have been published. And where I have a problem with the publish or a perish culture is the teaching staff who focus on work that doesn't result in publication, such as instructing the undergraduate students or supervising the postgraduates, may actually lose ground in competition for available promotion because they have been focused or they have been spending all their time and resources in instructing the undergraduate and the postgraduate students. And my main concern with this publish or perish culture is this is one of the biggest contributing factors for replication crisis. I just thought that I'll introduce this word to some of my young colleagues today. The replication crisis is an ongoing methodological crisis in which it has been found that the results of many scientific studies are difficult or impossible to reproduce. Because of the pressure to publish, anything is published. There is no mechanism to uh, measure or gauge or identify which are the good publications and which are not. So, the downside of this publish or perish culture is that the academic community is obsessed with quantity rather than quality. And this, to some extent, has also perpetuated bias in the academic institutions. Oh, he has so many publications more than somebody else. But that somebody else has actually been contributing to undergraduate training. Somebody else has been managing the NAC data. Somebody else has been managing the ISO documentation. So obviously, he doesn't have the time to publish. And on the other hand, there is a bias that has perpetuated in academic institutions between those who publish and those who do not. So for me, this to some extent also decreases the value of resulting scholarship because the scholars are actually scrambling. They are spending more time scrambling to publish whatever they can. And it also sometimes detracts the professors' uh, time and energy from mentoring graduate students. You go and talk to a professor, he may simply say, "Oh, I have to finish this publication. I have a deadline to submit this grant. I I have to I have got the galley proof, so I have to send it in the next 24 hours. So all of this is for your own benefit. In what way it is actually helping the department or the student who is here because of you? And one of the biggest concerns of this culture is that it's linked to scientific misconduct and at least some questionable ethics. There are fraudulent data being published. There is something called a salami slice. Instead of publishing one large body of research work, people break that down into four different papers so that they have more number of papers. So why are we discussing a performance appraisal framework is because much of the weightage, even in a performance appraisal framework, even in some of the better known universities, is the research productivity and the research output. And the reward for exceptional teaching rarely matches the reward for exceptional research, which encourages the faculty to favor the latter whenever there is conflict. So, somewhere I think it's important for us as administrators to understand that there has been an adequate contribution also from the younger colleagues who are involved in teaching, and also the senior colleagues who are supervising the postgraduate students and bringing out the research papers. But then there has to be some parity. Somewhere, I think, through this performance appraisal framework, which I thought that I'll share it with you folks later on, has to be a fair mechanism of assessing everyone with what they are good at, than assessing everybody just based on their research productivity. In fact, as Mandana was sharing an anecdote, I have also a very interesting anecdote. I think you all have heard about the Higgs boson. Uh, uh, Peter Higgs is a physicist who won the Nobel Prize in the year 2013. And he goes on to say that it's difficult to imagine how I would ever have enough peace and quiet in the present sort of climate to what I did in the year 1964. And he goes on to say that I wouldn't get an academic job. It's as simple as that. And I don't think that I would be regarded as productive enough. When he feels, a Nobel laureate feels, that there is so much of academic pressure to publish academic uh, uh, papers. So you all know where exactly uh, what exactly this pressure can do, and how it is leading to a lot of unethical practices in order to increase the number of publications on your CV and to make your CV look better. The priorities of a professor has changed. So I think it's important for us to take a holistic look at it and revisit the entire performance evaluation framework. So we can discuss a lot more with some of
Yeah.
the questions from Dr. Mandana and others.
So here is something I found that was interesting. There is even a law, Goodhart's law. When a measure becomes a target, it ceases to be a good measure. So this is like the same thing. When the appraisal measurement in terms of publication to say how good or how much you're working in terms of research itself, the number has become the ultimate measure. I guess it has stopped becoming being a good measure, good way of measuring, because it can always be, of course, worked around. You can either make a large number of very low quality things or very, very few things that really again don't do the job. And this is exactly what we have here. So like you said, Raghu, is that a number of things. Of course, there is one thing before we go on, and this is not necessarily falling in today's discussion. I know this is a matter of administration, but something that even I had realized while I was attached to an institute is that very often, because it's easier to do, because it's cheaper to do, institutions begin to give work to doctors, to people who should be doing academic work, which is literally clerical work. And I always wondered, this was one point of discussion I always had, was that you take someone, a highly, what I would say, a professional, someone who is very specific and who can do very specific things, but do them very well. And you're just making them do very general things. That is something that is neither interesting nor really it does not make you feel better when if I'm just made to sit and fill up some 30 forms that anybody could do. It doesn't give me any satisfaction. It doesn't make me feel like I should do something more. It doesn't make me feel like I can go on. Now this is something that I feel our administrations need to begin to understand, that it is a waste when you take a doctor and give them forms to fill. When the forms are of a patient and you are just filling your immediate patient's details, of course that is something you should do because no one else can do it. But when it is something where you are going to give somebody this body of this collection of paperwork to do, which is just gathering data from point A and entering it into point B, is really not the best work, not the best thing to be doing. But it does get passed on very often to the academic staff. And I think that is very sad that most organizations do not understand the loss to themselves, actually, because those academics could be doing better things than entering, just plainly entering data. So this is of course one point, and I know it's a little out of this, so let's say go back to the topic now. The discussion, so we have this, we know there is a problem in terms of evaluation, but evaluation is needed. Finally, you have to have a way of knowing how someone can progress academically, and how you can for a lot of administrative and planning reasons. And also I think finally we human beings need a challenge. If we are not challenged, if there is not something to reach, very often we will begin to wander away and waste our time. So there needs to be that little carrot somewhere. So, keeping that in mind, we still definitely need appraisal. But what would be the better ways of appraisal? Now, there was this before we go on, and okay, I will share that later. Yeah, Raghu, what do you feel now? So, we are going to now talk about how to improve
No,
the system.
before that, Mandan, I just
Yeah.
want to dwell on this point again, because this is
Hmm.
something that I am very concerned about. And I thought a platform like this at least will get us thinking if we are doing the right thing or not. You see, I was talking to you about two things: the quality
Yeah.
and the unethical practices. So, what has this actually resulted in? I was going through some statistics yesterday. The annual growth rate of publications was about 4% between the year 2010 and 2020. However, between 2017 and 2020, that is in the last 3 years, the publication output has increased by about 5% year on year. And I was just looking at the Scopus database, and up until 2020, we had about 2.9 million articles published. And this increase in the number of articles has also led to the growth of many journals. Every day we see a new journal cropping up. What is really important is that only about 45% of the articles published in the top 4,500 journals are cited in the first 5 years of publication. 45% of articles published in the top 4,500 journals are cited in the first 5 years of publication, a figure which appears to be dropping steadily. And only about 42% of the papers receive more than one citation, of which 5 to 25% of these are self citations by the authors or the journals. And majority of the papers still go uncited, which only means that they are neither appreciated by their peers, or are they, or those papers of any importance either to the industry or to the patients. So that is the one aspect, that there is a definite uh, dip in the quality of the published body of work. And the second thing that really bothers me is the unethical practices. See, it's frequent to find that the head of the department and the senior professors are producing a dozen publication in a year. So, which means that the person has conceived the idea, has got the institutional review, has got the board clearance, has done the research, and has written the paper pretty much once every month. So, which means that they have published a paper every month. It's virtually impossible for a human being to do this. Being a professor or a consultant sometimes automatically implies that whatever paper goes for publication from their department will bear their name. This is unethical practice which has to be discouraged at all levels. In fact, the International Committee of Medical Journal Editors and the Journal of Research in Medical Sciences authorship criteria says that each author must contribute a significant segment for being eligible for authorship. So I know that it is difficult for some to swallow this, but I don't really think that just being a senior professor in the department or the professor of the head of the department gives you an inherent or an intrinsic right to be an author if they have not contributed to the research. So before we actually move into the evaluation framework, uh, publish, publish or perish is a harsh reality, as I mentioned, and it has become a way of life. Publication, I am not saying or denying that it would not improve patient care. It certainly improves the patient care. However, equally important is the fact that the research done actually benefits the community, the society, and the patients. Writing a publication just to improve the curriculum vitae should not find any merit in practical terms. Published research work, if it is done only to improve one's CV, should not find any merit in practical terms. A thought must be spared by the researchers for the quality of research that is being carried out. It's not a race that one has to have more numbers than the other. And at all levels, this race has to be curbed. And this should not become a metric to gauge that one is superior than the other. This not only uh, brings down the scholarly output, it also leads to a lot of questionable practices and fraudulent research. So that is why it is important for us to take a holistic view of the performance evaluation system. Uh, so I think the next 15, 20 minutes, I think that it's important for us to see how exactly we can have an all-round development of a professional, and how as the head of the department or the head of the institution, that it is important for us to groom that quality which is the best in an individual. I mean, you can't obviously have everybody bad. You don't have to have everyone bow. So you need to really have the horses for the course. You can't obviously have everyone right, everyone teach, everyone be good at clinical practice, everyone also be excellent at administration. So, in order to discuss these four elements, which I think that every one of us as a teaching professional or somebody who is involved in any academia should decide at some stage, what is the best for me, what is the best for my patient, and what is the best for the university. Because my contribution is just not important for my own professional growth, it also has to be important for the departmental growth, which in turn helps the institutions and the universities grow. So, with this thought, I think we should uh, discuss now the performance evaluation framework.
Shall I share that?
Yes, please.
Can you see it?
Yeah.
Okay.
So, this is a framework which I thought should be discussed in every academic setup. I mean, if you see, there are four quadrants, and on the upper, uh, how do I maximize
What do you want
this?
to do?
Yeah.
What we can do is we
Yeah.
just.
So,
Okay.
the academic contribution, the clinical services, the research output, and the administrative involvement. Uh, so, everybody is expected to do everything. But the quantum of what you want to do at the level where you are can vary. For example, if I am uh, an assistant professor or a lecturer, I don't have a postgraduate student, I'm too young to write research grants, I'll do the basic minimum to keep my publication profile. I'm not the head of the department, I don't have the administrative role. So it's necessary that for somebody who is at the beginning of one's career, the academic contribution, which includes lecture plan and content, the laboratory, the practicals, and the clinical engagement, and more importantly, the student feedback. So that should have the maximum weightage. So these are about 25% each. Like if you see academic contribution, clinical service, administrative responsibility, and the research output is about 25%. But then it's not possible for a very busy clinician to spend time in research. So here, for somebody who is generating revenue, for somebody who has been seeing the patients day in, day out, the percentage or the weightage for the patient care and the laboratory services has to be more. The minimum is, of course, 15%. But a clinician can choose that, okay, look here, I don't want any administrative responsibility because I'm too busy, a clinician. I don't really think that I can even contribute as much for the laboratory or the practicals, but then where I can compensate is by seeing more number of patients. But for doing that extra bit, increase the weightage of the clinical services to more than 15%. At the same time, someone who is an active clinician also should be encouraged to advance his own professional career by doing some fellowship overseas, or should be encouraged to do certain faculty exchange so that it upskills his clinical acumen or the clinical prowess. So, for which you have some weightage so that you know that he is constantly trying to improve on his professional growth. And it's also important that somebody, just because he seems to be busy, doesn't have to use this as an excuse to not teach or not to do any research. So it's important for us to also have the patients or the services feedback, which has about 5% of weightage. So here the contribution from this clinician is more to establish your clinic, more to have an increased patient flow. It is for improving the patient satisfaction. And somewhere his clinical services will feed into research. For those who are actually interested in research, see, it's important that a major emphasis has to be on research, because if you take any of the ranking framework, 60 percentage of weightage is given for research, of which 30 percentage of weightage is for the field weighted citation impact. I was giving you the statistics. Out of the top 4,500 journals, about 45% of papers are not even cited, which means that they're not impactful enough. Your peers do not really approve your research. So you can't really be happy that you have tons of publication with, say, the field weighted citation impact, which is less than zero point 0.5, which means that 95.5% of the work that is done in that particular field is above your field weighted citation impact. For example, if my field weighted citation impact as of today is about 0.93%, it's only about 0.7% less than the world average. If somebody's field weighted citation impact is, say, about 1.4, which means that his field weighted citation impact is 40% more than the world average. So, which means that the work that is being carried out is impactful. So, you identify some of these researchers to collaborate with some of the clinicians and let them do some impactful research. They have to publish papers, they have to submit research grants, and they also have to supervise PhD scholars. So, you can't obviously expect them to be doing the laboratory work. You can't be obviously expecting them to be doing carving. You can't be expecting them to be taking up some IOE work or the ISO work or the NIRF data or the NAC data. So, because these are busy clinicians, and your institutional ranking is dependent to a large extent on the body of work that these researchers publish. I was telling you 30% of weightage is for the citation, and the 30% of weightage is for the research productivity, research income, and the research reputation. So you know where exactly you can score marks in the National Institutional Ranking Framework if you have to really be cut above the rest. So I think somewhere, if you have the head of the department who's there by the virtue of seniority and by the bare minimum number of marks that he has to obtain, but has never ever published a research alone, has never ever corresponded, has never ever written a grant, is actually not good for the department or for the student or for the institution. So I think this is where serious introspection is required. I mean, I'll also come to the administrative responsibility. So, non-academic responsibility is important. A dean cannot be writing a research proposal. The head of the department obviously has other responsibilities, but it's also important that some of the things that one has to work on is the self-development and other competencies. In fact, to stay in academia itself, the number of awards that they win. So these are all some of the things that you have to, like, if an institution has uh, been in the top five, much of the credit has to go to the head of the institution, because here was the head of the institution who knew how to take the institution forward. So this is where he has to be assessed. So I feel that all these four components have to be measured and given an appropriate weightage according to the situation, according to the cadre, and according to the circumstances. So this is something that was just developed with Dr. Mandana when I was having a discussion with her, and this is not something that is anywhere available. Uh, it is just a thought that there were some discrimination, there was some disparity in the way the faculty were assessed using uh, a common yardstick for all cadres at all levels. So that's why I thought that it was important for us to uh, introspect on this performance framework, and this, depending on that, one has to decide if somebody is eligible for a promotion, or if somebody is eligible for an incentive, and if somebody is even eligible to be in academia. So these are the things which we thought that we should be discussing in today's meeting.
Yes. So, something very interesting just came up. Now, we have already discussed this, but uh, from today's this collective work, something just struck me. I shall remove that. Is one thing we did not discuss earlier is that now, okay, we want the individual institutions to hopefully up and change and improve the appraisal system to take in view a more holistic view, approach to everything that goes into an academic life. I would say a professional presence. But there is one thing: the international ranking, like you were talking about, of even the national level, the top institutes, a lot of that weight is still from research. So I think we need to begin to change, or as a whole, that mindset also needs to change, that it cannot be so heavy on research. It needs to be equally divided. Means an institute's collective ranking also needs to take into account everything else, and not more on research. So that is the next stage, because otherwise institutions will have a problem, because they are thinking about their ranking, about their overall ranking, more than they are really thinking about their individual staff or individual faculty. So if we cannot change that system, then this system cannot change. So we have a catch 22 situation. Of course, it's something that conversations are needed. And once we begin, it's like we discussed this, but at that moment, I did not think of it. This only occurred to me now while you were talking, that this needs to be done. If we want one to change, the other has to also change. Yes. Let's see. I think so. We have that in place. Now, I just share this one thing I found while I was checking out this. Is this whole concept of the ways to appraise is apparently weighing on a lot of minds, because this is a research that someone else had done. Okay, now in this, it's very interesting. They did a research to identify different ways besides the typical publication sort of a thing, to identify different ways you could actually check academia. So they have done a study, and these are the things that they have made. This is just a sample of what they have done. Is an appraisal system where there were so many headings, and they used a comprehensive knowledge in the teaching field, Then deontology, which basically is about ethical practices and availability for teacher student communication, presentation skills, passion for teaching, class preparation and management, student examination, quality of teaching materials, research and scientific productivity, administrative skills, and reputation. Now, they of course found that a lot of this, the first few, is they can take the feedback from the students because they are student centric. But for some, it is the administration that can give, and for some, the peers can give. And of course, there is part of it which is from the research side itself. So, this was some very interesting thing I found. I thought I should just share this with you all. So there are actually, this is an ongoing work. There's a lot that's happening. And in this, as you can see, what I found very interesting, the teaching skills are very heavy. The teaching and student relation skills are quite heavy on this in comparison to the many other ways, the appraisal formats that I saw. This one was one that was particularly more student and teaching related. Of course, this was not necessarily for anyone in the medical side, so it's not really taken into account, obviously, the a practice of medicine or dentistry. So that is there. But so this was something that we had. So let's see what everyone else has to say. So, of course, lots of people are finding the discussion interesting. Dr. Shilpa, she's enjoying the talk because she can correlate, but nobody takes into account all these two duties. So I can see that those administrative work is getting to everybody. And Dr. Ratu saying yes. Mm, yes, that was when you were talking about the research. Yes, about the quality of research. Okay. And very interesting topic. So we have here Dr. Sham. How feasible is it to adopt separate faculty tracks like what is practiced in the US universities? They have clinical track, tenure track, lecturer track modes, with each having graded weightages for, I assume the rest of it is here, for clinical responsibilities, research contribution, and teaching responsibilities. What do you think?
No, we have discussed this, that there has to be a
And
separate
yes,
faculty tracks,
yeah,
and
yes,
each having graded
yeah,
weightages. But you need resources, and you need a vision. For example, a tenure track. So you're only going to get tenure if you are recruited as a research faculty, and the pressure of a research faculty is that he has to publish so many papers, bring so many grants, and after so many years he becomes tenure. And once he becomes tenure, there is complacency that sets in. And that is the bane of having this tenure track, at least in an Indian system. In fact, even without doing any research, Dr. Sham, we are all tenure. Nobody punishes for not publishing, nobody punishes for not taking classes, nobody punishes for poor performance. We are in some ways harnessing mediocrity. It's important to understand that to be in an educational setup in any university in the US, you need to have a PhD. Only if you are a PhD, it means that you're able to guide the students and also able to publish research work. But it's not mandatory for somebody in the dentistry or somebody in the medical field. But then, if you see most of these universities in the US, as you have given, as you've taken that example, they are either MD, PhD, or MS, PhD, and only then they're deemed to be eligible to be in an academic setting. So I think it requires a lot of stakeholders to be involved for this uh, discussion, because I think on a platform like this, we know that there are options that are available before us, but then uh, is it really uh, possible to implement that at an academia in the current shape and form, is something that I think we need a larger forum for discussion.
Definitely. That has to, this is supposed to be just the initial tinge to get everybody going, the initial thing. But we had discussed something which we didn't talk about today, is that one very good way would be that at the beginning of a year, if I say as an academician decide that this year I'm going to, and I can tell whoever is the administration where I'm working, that this year this is what I'm planning to do. I'm going to do this much research, I'm going to do this much, whatever teaching, or this year for whatever reason I'm not going to do that much of research, and I'm going to be doing more on the research, more teaching, or more clinical work, as far as we are in the medical and dental field. So that is something where each one of us can decide in certain ways what is going to be what we are going to do in the year. So at the end of the year, both me and the bosses have a yardstick. Did I fulfill what I was going to do or not? And that could be an appraisal system, both for me to evaluate and know, have I fulfilled what I set out to do and where I stood in that, and possibly change whatever did not work. And also for them to know, okay, this was settled, we agreed on this, and this has happened or this has not happened. This could be one way that we can work around the system.
Yeah, I agree.
Yeah. So we also have now a comment from Professor Joss. Publications within the department framework of niche expertise are more valuable towards the development of the department's profile than publications on random, sporadic topics. Yes,
I
that is true.
agree with him 100%. I agree with Dr.
Totally.
Jose.
Yeah, this is
Because everybody
something,
wants to do everything. Uh,
everything.
I mean, I think at this point in time, I just want to share my own experience when I was in University of Sheffield. Prof. Spate was very particular that you identify a niche area for yourself. So if your focus is HPV and oral cancer, have as many papers as possible in the chosen domain. But if somebody is interested in doing some work in uh, the oral microbiome, or somebody who is interested in doing something on exosome, or somebody is interested in some red complex or something which is unrelated, you just don't cross over. You develop a niche area, you identify a niche area, and then become an established researcher in that area. By the time you retire, you should have at least about 100 to 150 papers just on HPV and, say, the head and neck cancer. Or somebody who has chosen to work on the oral microorganisms and then oral cancer. Much of the research uh, uh, output from this researcher would be in the chosen niche. So I think it's important for us to understand that you'll only become an established researcher, you'll only be able to establish yourself as someone who is an expert in a certain field when you choose right at the start of your career that salivary gland pathology is something that I'm very passionate about. So I'm going to spend the rest of my career researching on salivary gland tumors or salivary gland pathology. And likewise, somebody has to decide that, okay, submucous fibrosis is an area I have to work on. And for the rest of my career, at least 80% of my papers will come from submucous fibrosis. So I think if somebody, I mean, Dr. Josh has brought out a very pertinent point here. I, it, you cannot really choose any random sporadic topic. So everybody is doing, I have got a particular molecule, so let me try it on odontogenic cysts. Or I have got some antibody remaining, let me also try it on ameloblastomas. Or I have some more antibody remaining, so let me try on lichen planus. So you're basically uh, everywhere but nowhere.
That is very true. But although I do find there is one way, in the sense that this, of course, no one should take this that, and I know that Professor Joss does not mean it like that, and neither does Dr. Raghu. That that the department should become a little theocracy kind of a thing where where you everything happens as per the head of the department and one field of interest. No, all it says is that a number of people, whoever are there, can each choose their own field, and then that person will be associated with those studies. So say if I am the head of department and my interest is oral submucous fibrosis, it is not necessary that I'm also there in every forensic and every other field that happens and every other research that happens, but I can give that interest or that work to someone else within the department who has that area of interest. And I think that is exactly what is necessary, not limiting, but definitely staying within an area of strength, coming into the research from an area of interest of strength. Because more than anything else, if I know nothing about a field, I cannot really guide it. It becomes where is the guidance then? There has to be some amount of interest at some section of that field to be able to guide that topic properly. And I would say that that is the main requirement there. Even though all of us are constantly learning new things and new skills, but some intersection of some part of a larger topic should be something that one knows or one is interested in at least. So, okay, Dr. Santosh says very introspective discussion. Dr. Joss has this. Sadly, when senior academics settle in their top positions, which they have attained through their publications, they have to spend most of their time on university administration duties. Yes, that is true. But I guess that's what Raghu was saying, is that that is when you can take the weightage from something and give it to something else. So that's where administration comes into uh, play a role. And also because finally, without administration, also things cannot run. Administration is as important as is the rest of the work.
Now, it's important for some of the researchers to be in an administrative role, but then they should not sever their umbilical connection from the research, because research has always been their first love. And administrative responsibilities, because you want a good researcher who has an understanding of how the research environment has to be, also to be in the administrative position to bring about certain changes which is in the interest of the organization. Because I remember in the year 2015 when I returned from the University of Sheffield, when I was given this administrative responsibility, my first task was that, Raghu, you'll have to develop the research policy for the university. uh, I knew that we didn't have one, and now that we have to develop a policy, so it has to be developed in such a way so that it benefits the researchers across the campus. So uh, I wouldn't really imagine somebody who's a non-researcher would be in a position to develop the university's vision document or a research policy. But then I think somewhere I feel you shouldn't really become complacent at any stage. Even if you are in an administrative role, you have to contribute something to the research, because that is where you are identified and that is what you are identified for. So I don't really think that at any stage in one's career, probably the the amount of research work that you did about 10 years back may not be of the same intensity 10 years later. But still I feel that somebody has to uh, that is what you are passionate about. Nobody would ever say that I'm passionate about administration. You become an administrator because you spend so much time in an organization and somebody wants you to be in the leadership role. But then leadership should not become an excuse for you to become lazy. I think you should uh, be in a position to develop more leaders. You can't then just have followers. So you have to build that critical mass of researchers. Now that you know that this has been your niche area, and okay, this is an emerging area, so you build a leader in that emerging science. So I think it's important for a researcher to also take up the administrative responsibility, but then it's a very responsible position. Being an administrator is just not to tell the whole world, look here, I'm the director of research, I'm the director of international relations. It's a very responsible position. So, how you are responsible for taking the university from where it is now and where you would want it to be 5 years from now?
True. This is an interesting one, which I think all of us can note is, from Professor Joss, universally, there is an unwritten rule about an average of 40% teaching and learning, 30% clinical activities, 20% pure research and publication, and 10% of administrative performance. So this seems like a good thing to keep in mind. But I have to say to both of you, as the last administrative role I had was as head of department. But I always have this thing, when I joined teaching as a junior staff, my biggest problem in life was that I had so many ideas, so much energy, so much I wanted to do, but I did not have the authority to pass them through. And I was very happy the day I became the HOD, because I said, wonderful, now I can do all those things. But the thing that happens is that then you realize that two things happen. One is, of course, you're not as young as you were then, and not as much energy. And the second thing is, now you don't have the time. I can easily say that, yes, I want this work to be done, this research to be done, this whole proposal to go through, but I really don't have the time any longer, because of course the what I would say, the extent of duties have increased. And this is something everybody, I guess, faces, which is what we are going to have to work at, balancing things and working on what matters. But there is administration, and the higher that administration go, now I was the last one was head of department, but I have seen the dean work, and I know just how much more complicated it was for him. And I can think, as it goes about, say, the university, and it gets even more and more complex. It's all very difficult, and of course it is going to take time and energy to stay there. So it's all about, well, many balls in the air and managing all of them. So Dr. Sham says, how involved is our dental research fraternity in translational research, which I believe opens up a larger canvas considering how we are on the bench side of the translational spectrum. What do you feel?
How involved is that dental research fraternity? I mean,
Difficult
they
to answer
are
that.
involved. See, it all research is not just about having an idea. It's about executing it. Because my professor, would always say, Raghu, idea is cheap. What is important is how will you execute your idea. So, I mean, when you say translational, I want a drug for oral submucous fibrosis. So, what is that I am trying to target? Have I identified that molecule to make it translational, or am I discovering a molecule to do a translational research? Even if I have this grand idea, do I have the resources? Do I have the necessary expertise? Do I need to collaborate? So, in all of this, collaboration is the key. Collaboration is the key. So, it sounds fascinating to say from bench to bedside, but bench to bedside happens when you decide on a research topic now, and by the time you retire, I have found that molecule that I was always interested in. I mean, all of us have this wish that someday we have to find a cure for oral cancer. In the process, what we do, we take up some study for a postgraduate student, And we have this time identified, say, a marker which is uh, a proliferation marker, which will tell you that okay, from well differentiated to moderately differentiated to poorly differentiated, this there is an increase in expression or there is a decrease in expression. Subsequent to which, what how did it benefit the patient? So this is where uh, addressing the right research question becomes the key. So I feel translational research requires committed time, dedicated resources, and uh, a lab that is supportive. I, all of us are interested in doing translational. It's just got that, because anything that you do has to benefit the patient at large. It just can't be identifying the mechanism. At some stage, the importance of this mechanism, are you trying to target this pathway, or are you trying to say that this is the pathway that was responsible for the worsening of the condition, and by disrupting this pathway or by targeting this pathway, that is your clinical benefit, but for which you will have to identify that niche area and then persist with your idea, and then throughout your life just focus on that one idea to eventually develop that one molecule, if we are fortunate enough in our lifetime. Or else, we all are doing research, but I don't really think that we are geared up to do that kind of translational research, because none of us really have the necessary expertise, and more than that, the money, because it involves a lot of funding, and more importantly, a collaboration. And I think unless we develop all these things, it becomes difficult for an individual to be doing the translational research. It involves a clinician, it involves laboratory personnel, it involves students, it involves you, it involves a network. So I think it's a great idea, but then it requires a lot of commitment from an individual researcher.
I also feel that this is where citations are important, not just because of the fact that someone is, citing your work. What does that citing of your work mean? Means that someone else is using your work to build on it. The very foundation of human knowledge, the body of knowledge that we have today, is because we have kept on building on each other's work through, well, all time. And that is what happens. So if that is where that citation comes in, and that is where it comes, I think any one of us, the work that we do, if it is quality, it does not mean that I have to take that work all the way to the end. If I'm contributing a little bit to something that eventually, maybe 20 years, 30 years, or whatever amount of time down the line, has finally reached us the end, the goal, I think that is itself worked. That's the way I would see it, because we are each of us just adding one little drop, and drops make an ocean. I think that sort of works too. It's in the same way. So, okay, we have one here. I think Dr. Ratu is basically saying there's a problem when universities use a regular appraisal for dental academic, social academic, and business. Basically, yes, because obviously we have, then in dentistry and medicine, we have things like clinical work, which others would not have. So that's a very different thing. And a very important part, because the training involves actually patients. So our involvement there makes a difference. And Professor Joss, the problem around these universal university frameworks is that these do not address the same diagnostic laboratory and lab experience, which drives the essence of academic and oral pathology. Yes, that is true. And Dr. Sham, the point on collaborative research is very true. A good number of research intensive labs on the Department of Biotechnology are doing good research on the bench side of it. Very true. Yes, it is. Finally, I think this is a world today which is all about collaboration. We can no longer stay in silos. It's just not possible. More than anything else, you think the average, I think this laptop of mine has got more processing power and a faster processing power than one human brain. There are multitudes of human brains. So I think the only way we can stay up to date with everything that's happening around the world is if we collaborate, even if you think from just the knowledge point and not even from every other point of doing work together. So, okay, I think we should call it a wrap and move on. So it was an interesting discussion. Yeah, we have no more comments and nothing more left. And otherwise, today we were also joined by a lot of people. Some we said hello to at the beginning. We had, of course, Dr. Sham, Dr. Niharika, Dr. Varun, Dr. George. Oh, that's Dr. Vandana Reddy. Okay. Dr. Ratu, we have said, Dr. Sunita, Dr. Divya, Dr. Meher from Fiji, and yes. So we have had our regular mix of audience, which is always the best part. We know everyone is there. And yes, we shall now, yes, with a thank you, Dr. Santosh, for attending and being with us. Yes, now I shall have to, yes. Yeah, your next one for your collection. Okay, I'm very amused every time I give you a certificate now, I must say. It's becoming a huge collection, I think.
Yeah, but I really treasure these, to be honest.
Thank you. That is really nice. Yes. So now going with what else is happening. Let me. Oh, did that share? Yeah. Okay. So now with this, yes. So coming to coming week, and we are just going to take a few minutes more. So the next one is about cleft lip and palate, which are significant developmental problems that we know. And the main thing is that the timing and the multi-speciality treatment is very important. You may wonder why, as oral pathologists, we need to know this, but I think everybody needs to know this and be updated because somewhere along the way, things are changing, things are progressing quite fast. It's good to stay updated with something this important because there is that one point where you need to tell someone what needs to be done. So we have a specialist, someone who's been working on this for quite some time, Dr. Soumya Tripathi. She will join us. She's already a part of the Smile Train. And I hope you will join us for this. That's next week on Tuesday. And beyond that, I got to say thank you for watching. Thank you for sharing, for your comments, for your likes, for your subscribes, which has taken us almost to 1,500. I think we are today on YouTube. We were just three short of touching 1,500 subscribes. I really appreciate it. I appreciate those of you who every week turn up here, interact, listen. It's really what keeps us going and what keeps all of us coming back. And I do hope you join us again soon and definitely join us next week. And I look forward to everybody being here. So have a great week. Be safe, be well, and come back on Tuesday. Bye-bye.
Thank you, Dr. Mandana.
Bye. Welcome.